Hello everyone, it's 10 o'clock, so let's get started. My name is Kevin Woods. I'm a project manager at 1 Million Solutions in Health, and I'll be moderating this session today. I want to thank you all for attending today's webinar entitled Connecting Your Clinicians with Consumers to Grow Your Business. And to get started, I'm just going to tell you a little bit about us, 1 Million Solutions in Health, and what we do before hearing from today's speakers. So at 1 Million Solutions in Health, our goal is to improve healthcare one solution at a time. And we do that by bringing new information and solutions to the life sciences, to healthcare, and to the area of helping patients and consumers. At 1 Million Solutions in Health, we work to help people around the world connect and to help accelerate research and new ideas, as well as the sharing of ideas between patients and consumers. We aim to improve healthcare delivery, accelerate life science research, and share patient and consumer-focused ideas and solutions. And we do that through events such as today's webinar and also through other discussions and forums. If you have any ideas, whether you're in academics or government or business or an entrepreneur, please contact us. We would love to work with you to share your ideas and bring them forward into a global community. So let me give you some background on today's presentation and speakers. So we know that increasingly health consumers are looking for expert clinicians who have a particular specialty or unique service. And correspondingly, clinicians are looking for consumers to connect with that can benefit from the services they offer at their clinic or hospital. And so this webinar is going to look at some of the key issues that come up when trying to connect clinicians with patients and what can be done to solve these issues. Turning now to our speakers, the first will be Dawn Van Dam, who is the President and CEO of Health Connections, which does marketing and consulting with the goal of transforming science into commercial success. Dawn is a graduate of the Wharton School at the University of Pennsylvania and winner of the Brown-Lee Award for Leadership. She brings to the table over 20 years of leadership experience in the biopharma and healthcare industries. Our second speaker will be Chris Messina, who is the CEO of Body One. Body One is a cloud software technology leader headquartered in Cambridge, Massachusetts, that provides online tools, websites, and web platforms for medical marketing and education. Their mission is to connect people with the health information that matters most to them. Chris holds multiple global technology patents and is an active blogger on social media and medicine, as well as on pediatric genetic conditions. He is a graduate of both the Harvard Business School with his MBA and Rutgers University with his bachelor's. He also was awarded a Rotary Fellowship to study at Sydney University in Australia. Currently, Chris serves on the board of the Harvard Medical School affiliated Mount Auburn Hospital, where he is an overseer. He is also affiliated with the 321 Foundation and the Harvard Business School Health Alumni Association. And then our third speaker is Michelle Alford, who is a content and social media manager at Body One. Michelle has been using the internet to connect providers with consumers since she built her first website 15 years ago. Michelle works in all aspects of web development and publishing, including writing, design, and marketing. She has produced podcasts, videos, and blogs, as well as written and edited content for traditional publishers. By staying abreast of current trends, Michelle is able to help companies find the best way to communicate with their target markets. Michelle received her master's degree in publishing and writing from Emerson College. So quickly before we get started, I'd like to say to everyone, please, if you have any questions, put them in the chat box that's on the right of your screen. You can select in the Send To box my name, Kevin Woods, or to the host, 1 Million Solutions in Health. And then I will take all the questions and ask them to the speakers after their presentations are done. And I'll also let you know that we'll be posting a survey later in the webinar, so please fill it out before you go so we can collect feedback on this webinar as well as ideas for future webinars. And now, without any further ado, please welcome our first speaker, Dawn Van Dam.
Great. Thank you so much, Kevin. Appreciate the introduction and the information about today's webinar. Very excited to be here. As Health Connections, we have partnered with Body One, the main speakers for today, to bring a really great tool to the marketplace to help you be more successful. And at Health Connections, that's really what we're all about. We're here to help you transform your science into commercial success. So whether your science is helping improve the care of patients, or your science is helping improve their diagnosis or their treatment, this is what we're here to help you with and help you be successful at. And so we want to support your growth, and because of that, we put together this partnership with Body One. Just to let you know a little bit about Health Connections, we have lots of different services to help you commercialize, but 3 that I like to highlight is our ability to help you do strategic market planning and market research. So if you want to understand better how to penetrate the market and how to be successful, that would be bullet number 1. We also are very involved in lots of education and training programs. And the 3rd bullet is fundamentally we do everything from soup to nuts when it comes to marketing communications, whether it be planning, executing, or solutions. So whether you need a press release, social media, a newsletter, a white paper, a website, anything across the board is kind of where we like to help you out. So if you're attending today's webinar, you perhaps have some goals in mind and things that you're trying to accomplish, particularly as you look out to 2015. And so I'd ask you to think about the following questions. Are you trying to find more health consumers or patients who are seeking your services? Are you trying to link providers in your network or those affiliated with your organization and have people understand how to get to the people who are with your network or your organization? Do you, as an individual or as an organization, offer any unique or specialized services not provided by other clinicians? So are you at the leading edge, or are you a specialist in a particular area that you want to let people know that you stand out from the pack? Or perhaps you are actually someone who works in the government and you're trying, or like a not-for-profit or a patient association or a physician association, and you're really looking to help the public identify the clinicians that are involved in a particular program that you may be running or you may be trying to promote. So hopefully these are some of your goals. You may have some other goals too, and if you do, again, stick them in the chat box and let us know what they are so we can give you some pertinent examples in today's webinar, and we can make sure that we address your needs in our discussions today. So as I said before, we are partnering with Body One to bring you this clinician/physician finder tool to help make your efforts at outreach more successful. So I'm going to turn it over to our main speakers today, and we're going to start with Chris Messina, and he's going to take you through the presentation, and then I'll come back again at the end and just give you some more things to think about and how to pursue next steps if you're interested in talking to us further. So over to you, Chris.
Thanks so much, Dawn. Thanks for that great introduction. This is a really exciting and important topic, given the importance of healthcare for us all. And our first objective in this session is to answer the critical question, why? Why should health organizations serve as an intermediary connecting qualified patients with trained clinicians? Well, there are 4 main reasons. The first is to increase utilization of the most effective leading-edge medical services and technology by facilitating appropriate patient demand. The second reason is to support trained clinicians and best clinics by flowing business to them in the form of qualified patients. The third reason is to leverage analytics to get a real-time understanding of both patient demand and physician and market dynamics. And then the fourth reason is to reduce overall healthcare costs by connecting the right patients at the right time with the right clinicians, products, and services. Now, state-of-the-art physician practice finders that do this, that accomplish this, they have 5 basic characteristics. The first characteristic is that they're global. So they can provide coverage anywhere in the world. But having said global, they're also localized. So in other words, they connect a patient, the right patient with the right physician or clinic in their most immediate area. They should also be personal and social. So they should have advanced sharing capabilities designed into every clinical listing. And they should be mobile friendly. So in other words, the connection could be made right from a phone, not necessarily from a computer, but from a smartphone, so that a pre-qualified patient can meet the best suited clinician for them right in their local town. So whether it's South Dakota, Saskatchewan, Sicily, or somewhere in between. And the last major point is that a state-of-the-art physician finder should be analytical. The internet is infinitely measurable, and generates a lot of actionable data, which to this point has not, for connecting physicians with patients, has not been utilized. I've been in meetings where a key leading physician asks the executive of a hospital system or in some cases medical technology business that they're working with, how can you help me understand and grow my business? How can you help me understand the dynamics of the patients who are coming to me through the Finder? And to this point, that really hasn't been done, but there are now tools that will allow you to do it. And last point that's maybe not on the slide is that state-of-the-art physician finders should be cloud-based. And what that means is they should be continuously updated in one location so they reflect progress in the state-of-the-art in technology and then deploy it in multiple places. Now, we at Body One have developed one such finder, and Michelle Alford, who manages this finder, is going to describe it in detail. And as she does, invite you to just think about the points that were raised earlier about is it social, is it local, does it have, is it global, is it mobile, and is it analytical? So at this point, I'm going to turn it over to Michelle Alford.
Thank you, Chris, and thank you everybody for coming today and learning more about our physician finder. I'm going to start with a quick overview of the finder and then go into more details about how it works. If you have any questions as we go along, post them in the sidebar and we will answer them at the end. The Physician Finder is the most robust physician locator on the market today. It has advanced functionality that allows patients to search your database of physicians and practices directly from your website. Because it's a plug-and-play service, all you need to do is add a few lines of code that we provide for you wherever you want the Finder to be located. All future programming updates will be made on our end, without any additional work required from you or your technical team. The system also allows you to stratify your clinical customers so that those who are the best, based on whatever ranking system you want to use, are rewarded with the most patient traffic. It has advanced analytics that will allow you to easily quantify its value to your customers and help you with your sales drives. Furthermore, to increase customer ease of use and satisfaction, it is fully customizable, allowing you as the administrator to pick and choose which modules you would like to use. The Physician Finder provides all of your doctors with a professional medical listing that is not only complete, but also easy to use and update. You'll be able to keep costs low while increasing revenue as more physicians come to you. So how does the Physician Finder help connect qualified patients and physicians? This is, of course, the most important question because it's not any good to anyone if the patients aren't finding the physicians. This is the standard display module. It shows countries separated by states, territories, or regions. And as Chris said, it is global. So in addition to the United States, it's fully international, and you can personalize which countries are given preference. When you click on any of these areas, you'll get a list of physicians within that area. You can also search by zip code or postal code to get the doctors that are closest to you. You can zoom the map in or out to see more or fewer physicians and search by either the closest 5 physicians or all physicians within 10 miles. And finally, we have an advanced search that allows patients to search by any criteria important to them, including specialty, gender, and insurance accepted. This will allow the patient to really find exactly what they're looking for in a doctor. So how can the listings be organized to promote your top physicians? Because you want the patients not only to be finding physicians that are close, but the physicians that are absolutely the best. So this is the default listing style. It includes all of the most important information for patients, including address, phone number, and website. But the listings can also be customized to display hierarchies up to 3 levels deep, showing primary physician results first, then secondary, and then tertiary. These hierarchies are entirely customizable. So in this example, you can see the luminaries, which are indicated here with the light bulbs. Those are shown first. Doctors with hero articles, which is the circle with hero written in it, are shown second, and doctors who don't have either of these are shown third. Other customers choose to rank by board certification, patient rankings, or number of publications. Hierarchy names and icons can easily be added, changed, or removed at any time. So how can the Physician Finder help draw patient traffic to your site? Because, of course, the Physician Finder doesn't do any good if you don't have the patients on your site to begin with. You also want to draw them from elsewhere to your website. So this is the Physician Finder widget. There are several designs for this, and we do them differently for to match whatever aesthetic the customer wants for the widget. It can easily be placed anywhere that allows code. So this includes sidebars, social media sites, advertisements. This means that if you have a blog, you can include it there, or if you're running an advertisement campaign, you can include it in the ad. Regardless of where the patient searches their zip code from, they'll be taken to their search results on your Finder, on your website, on your Finder. In addition, each physician in practice gets their own office information page, which is basically a miniature website. It includes a bio, picture, map, contact information, insurance accepted. You can see all of the different categories of information that we have here. In addition, some sites opt to include videos or social media feeds and links to relevant educational materials. This gives physicians and practices a place to show off their credentials and increases search engine optimization for your site. So now when patients search for individual physicians, they'll find your website. As I said, this is the physician page, but there's also the practice page, which gives practice information first and then lists all of the physicians who work for that practice. So how does the Physician Finder make it easier for patients to contact physicians? Once the patient finds the physician, then it's very important that they get in contact and make an appointment. In addition to providing the address, phone number, and fax, the Physician Finder makes it easy for patients to email doctors for more information or to set up an appointment. Some people worry about spam, but doctors in the system are protected from spam in several ways. First, their email addresses are not listed. Instead, patients use a form. Second, the form has a CAPTCHA to block robots. You're probably used to seeing CAPTCHAs around the internet that have images of letters or numbers for you to type. We actually use a swipe CAPTCHA because it's easier for robots to recognize different types of text than to understand how to swipe, so less spam gets through. We also run all outgoing mail through a spam filter, so that any spam that does manage to make it past the CAPTCHA isn't sent to the doctor. Patients can also save a doctor's contact information to their computer or mobile device, or send it to a friend. The file is a VCF, which is the Universal Digital Contact Format, and can be saved to and opened in Outlook, Gmail, or mobile contacts. This means that if a patient wants to call a doctor or look up directions to his or her office, they have the information they need immediately available, no matter where they are. So how can physician information be updated? Now, this isn't a phone book or a catalog. Unlike those, people expect everything on the internet to always be up to date. So it's important that even if the phone number for a doctor only changed a week ago, it should be changed on your site. Now, the first thing you should know is that it's not actually necessary for you to do anything. The Physician Finder is fully integrated with customer relationship management or CRM systems like Oracle, Salesforce.com, and SAP. So if your company uses any of those, we can use them to automatically update all physician and practice information. You can also send us an Excel or CSV file with all new and updated information for us to upload. If you do want to manage the information yourself, the Finder includes a password-protected interface that allows your team to create and edit listings and view stats for their existing listings. The listing interface is intuitive and easy to use. It can also be customized for each customer's needs. If you have any special credentials or links that you want to include for your doctors, we can add fields for those. In addition, listings can be made, here we go. In addition, listings can be made, easily be made inactive if a doctor or practice no longer fulfills the criteria to be listed, and then reactivated at a later date, which is often the case for practices for whatever reason customers want to no longer have a doctor in the system currently, but might want to add it later. You don't want to have to add all of that information in again. So who has access to updating physician information? Because you don't want just anybody to have access to updating your site. We actually have ways to make individual accounts for salespeople, practices, or doctors, depending on whatever your preference is. And administrators have the ability to create new accounts and attach or detach practice listings to each account. So this means that when someone is signed up in as one of those accounts, they only see the listings that are attached to their account. So for example, if you have a sales rep in charge of 5 practices, like this one here, they can only see and edit those 5 practices. Practice and doctor accounts, of course, only see their own practice. We also have an approval system where administrators can review and approve all changes before they go live. So as you see in this example, a red box is put around whatever information has changed, and the administrator can choose to approve or not approve anything before it goes on the site. Nothing goes on the site until it has been approved. So how can you translate the value of the Physician Finder to the physicians and practices who buy your products? And in addition to this, to your own sales team. We have in-depth analytics that track overall trends such as traffic flow, where people are searching, and what visitors are most interested in that can be used by the sales team to show practices why it would be valuable to be included in the Finder. We also track practice-specific information, such as how people find the practice and what they click on when they arrive. These reports are easy to print and share, and our experience has been that the physicians really like having this additional information of how people found their practice and what they're interested in on the practice, as well as how many people are coming. In addition, for many sites, we send doctors or practices an automatic email every month to tell them how many listing views, office information views, and patient emails they have received from the Finder. Sales reps can be CC'd on this email if they've attached doctors to their sales profile. So, in summary, the Physician Finder is a valuable tool that is simple to maintain and provides your physicians with a personalized website while driving traffic to your site. It has detailed analytics that show its value to both your sales team and your customers. There's a minimal learning curve for setting up and maintaining a Physician Finder, and we provide all customers with basic training. If there are any questions, as I said before, go ahead and ask them in the sidebar, and we'll be answering them very soon. And now I'll hand you back over to Chris to summarize everything.
Thanks, Michelle. So Michelle summarized the beneficial features of BodyOne's Physician Finder. I'd like to take just 1 minute to summarize the overall benefits to you in your practice or in your organization. The first is that you'll have reach as far as you want to go across the globe. The second is you have the ability to connect qualified patients with the most appropriate clinicians, which if you're a physician on this webinar, it might be you, and centers locally right where the physicians and the patients live. Third, the BodyOne's Physician Finder provides really rich analytics so you can evaluate the success of marketing and education programs in real time. Literally, you can look at it in, on a weekly basis, even a daily basis if you really wanted to. Fourth, as the world shifts increasingly to accessing health information from mobile phones, you can have the assurance that the BodyOne Physician Finder is leveraging mobile capabilities such as downloadable address cards, location, push to call, and geo mapping to connect the right patient with the right physician at the moment the patient chooses to engage in wherever they are. And fifth, the Physician Finder is easy to customize and install. Not only that, but because it's cloud-based, you'll be assured that the latest technological innovations will rapidly be available to you, your fellow clinicians, and your patients. So one last point is that utilizing BodyOne's Physician Finder or an advanced physician finder in general can really improve the bottom line. Qualified patients being efficiently connected with appropriate care are going to do that. So the numbers that we're showing here reflect the value quantified by a BodyOne Physician Finder customer in the cosmetic space, cosmetic surgery space. What this shows is how a very modest investment, and this is cumulative investment, in this tool drives both growth and profitability. And it does that it does that by facilitating state-of-the-art, modern, appropriate, and customized personalized health care. We at BodyOne cannot be happier to now have the ability to offer an advanced physician finder to you. So at this point, I'd like to thank you and remind you if there are any questions to submit them in the chat box. And at this point, I'd like to turn it back over to Dawn Van Dam.
Thanks very much, Chris, and thanks everyone for your participation and attendance today. I just want to make sure I'm okay from a sound check perspective because I know I'm having a few internet challenges, but I think I can see that you can hear me.
Yeah, we can hear you.
Great, thank you. If we could just flip the slides back to me because, again, I'm having some challenges with the internet, that would be great. So just to answer one question that's come in already, the Physician Finder is available all around the world. So we would like to encourage you to connect with us to learn more about it afterwards. And I just need to be able to, there we go, got my slides now. Okay, so the Finder tool, again, the overall goal is to help you connect health consumers with the right clinicians, even if whether you're the clinician yourself or you work with an organization where you're trying to reach out and let people understand that you have something great to offer. And you might be trying to grow your practice, you might be trying to increase your revenue, you might be trying to explain to them that you have a service that no one else in the area has. So really, this is a fabulous opportunity in today's environment to leverage the technology that we have at our fingertips today and to help people better connect with clinicians in the marketplace. So again, just to recap the goals that I talked about earlier, again, if people are seeking your services, if you want to know who's affiliated with your organization, if you something unique, or trying to identify people from your organization that offer a special program, like let's say you're giving out flu shots or tuberculosis testing or
Okay, it looks like we lost Don, so I'm just going to move into questions. And one of the first ones that came up, I believe Don already answered it, but was asked again, is it available in Southeast Asia region? And so maybe Chris, if you wanted to expand on that.
Screening, connect with us through our contact page. So I'm going to turn it back to Kevin and let him get some of.
Okay, thanks, Don. Chris, can you hear me?
Yeah, I can. Can you hear me?
Yeah, I can hear you. I'm not sure if we caught all of the answer for is it available for the Southeast Asia region, but
yeah, it is. So we have the global maps for pretty much all of Southeast Asia loaded in. So Indonesia, Philippines, Malaysia, Vietnam. Basically, it is loaded. So yes, it is available for Southeast Asia.
Okay, great. Thanks, Chris. And so another question that came in, it's also for you, Chris, is how do you prevent your Finder itself from becoming stale as technology evolves?
That's a great question. So obviously, Kevin, preventing staleness is important with any new technology, but particularly so with internet-based ones. At Body One, we also manage medical websites, and over half of our clients are come to us, our new clients, because they had a formerly great website that's suddenly acting old and tired, and in one case have been infiltrated by hackers who had taken over the homepage of the site. But that's not an issue with the Finder because it's cloud-based like Amazon, and it's similarly being continuously updated at one central protected location and then instantaneously updated across hundreds or thousands of websites globally.
Great, thanks, Chris. And perhaps you could answer this one, and then Michelle might be able to expand a little bit too. But another question was, is this the kind of service insurance providers might best be in position to use?
That's a great question too. And for insurance providers, this is a really ideal solution because it really allows them to match the right patient with the clinician who's providing the most appropriate level of service for that patient's condition. And that really, and by doing that, that results in the most cost-effective care. And also for the insurance company too, in the back end, they can track the analytics in terms of understanding the real-time utilization by both patients and clinicians.
Okay, thanks, Chris. Another question came in, it's for Michelle. Can you customize Physician Finder's data based on what information we use?
Oh, absolutely. As I said, the Physician Finder is fully customizable. So you can turn on and off different fields. So if you don't want types of data at all, you can turn that off, and your physician sales reps never even see those fields, which is often done with social media right now, because I think that some people are still a little uncertain about giving too much access to social media on their site, so they turn off the social media, but that still exists so that it can be turned on later at any time. And then we can also add any new fields, like if you just have specific types of information that your company uses that isn't in the database, we can add that in there.
Great, thanks. And I'll ask this question, which might be kind of a follow-up to that, is can the Physician Finder be redesigned to match our site?
Yeah, we actually do that a lot, mostly with links, colors, that kind of thing, because people want the colors of everything on the Physician Finder to match the colors of their site. But we can also make other aesthetic changes as long as it, of course, doesn't affect the usability of the Physician Finder.
Okay, thanks. And turning to kind of the legal aspect, Chris, what legal concerns have you seen?
Okay, yeah, sure. Thanks, Kevin. So that's a perceptive question. In general, tools to find physicians are really well established and expected by both consumers and clinicians globally. Now, obviously, the major concern is around potential inducement. In other words, are you giving something valuable, or is a physician, individual physician, getting something valuable in order to induce business from a technology or service supplier, for which then Medicare, Medicaid, Health Canada, the NHS, or other government payers are erroneously billed? So we haven't seen major concerns from the legal and regulatory departments of our clients, but obviously all new medical marketing programs should be cleared by these departments first.
Okay, thanks, Chris. And we have a couple questions for Dawn. I'm not sure, Dawn, if you want to try unmuting yourself, we can see if...
Can you hear me now, Kevin?
Yeah, we can hear you.
Great. Sorry about that. I think I fixed my internet. Yeah, go ahead, Kevin. Thank you.
Yeah. So the first question is, if I am trying to gather physicians for a new program and I don't yet have their names or information, how can you help me not just use the tool, but load it up with clinician information?
Great. That's a terrific question. Thank you, Kevin. Well, what I was trying to let everybody know before was that you can contact us at healthconnections.com. And if we can just maybe put up that previous slide for a second with the email addresses and stuff. Yeah, there it is. There's our information. But a lot of people, yes, are struggling to figure out how they can reach out to their communities, whether it be finding physicians, finding patients, consumers, whatever it might be. We actually have at Health Connections an extremely large database of over 5 million people all around the world. So we can tap into our database to see if that could help you. But we also have a number of programs to drive people to your practice, whether it be through social media, through newsletters, through enhanced website communication. There's all kinds of things that we can do to generate more interest in your area about the people that would want your services, and then also drive them to things like the physician finder, drive them to your website, and drive them into your patient practice. One example comes to mind of a physician that we're working with in a very competitive market in the U.S., in LA, and already just with a few tweaks to their program, he's seen a very nice increase in the patients coming in and the referrals coming in from other physicians in that geography. So again, thanks for that question, and if there's a follow-up, just let me know, and we can flip it back to the speaker presentation slide.
Right. Yeah, we do have another question for you, Don, that came in. It's, what if I need to promote the program to patients, the public, or the community? How would we go about doing that?
Great question. So there's so many ways to reach out into the world nowadays. I mean, some people like to hold actual events where they, have an open house at their location, or they go into, let's say, a local mall or a public area, and they promote their services. So because we do education and training, we can help in that regard. But then there's the more traditional ways where you send out flyers or brochures, or you ask, one patient to refer to another patient. And then with the advent of, this great big thing called the internet, there's so many ways to reach out, whether it be through something like Facebook or Instagram or Twitter or LinkedIn, or lots of medically oriented social media sites. There's ways to grab people and kind of get them more knowledgeable about your program. So again, if anyone's interested in talking about that, give us a call, and we'd be more than happy to help you understand. I know one particular challenge for people is if you're in the government or your patient association, or if you're, some other sort of quasi-government organization, just making sure that as you bring out new programs, that the general populace knows about what you have to offer. And that could actually bridge into things like radio advertising, television advertising, or billboards, et cetera. So again, we could always help you in that regard if you have a more global reach that you're trying to achieve. Thanks, Kevin.
Okay, thanks, Don. And this next one I'll ask to Michelle, but maybe Chris can add something at the end. How are you able to update which doctors are in network for patients with changes by Obamacare, for instance?
Right, so we do have an insurance panel to the physician finder, so that's something that can be updated through the back-end admin section. So doctors can do that. If you're with an insurance company, that can do that. We're also working on adding in a way to automatically update insurance plans. But that's something that's still in progress. Right now, though, all plans can be updated through the back end. Chris, do you have anything to add to that?
No, I think you covered it well. Basically, all plans can be manually added, and because this is changing so rapidly, we are working to implement an automatic system as Michelle described. So yeah, we're on top of this.
Great, thank you. And Chris, another question for you is,
Sure.
What are some of the existing customer applications using your Finder?
Oh, sure. Yeah, they've applications using the Body One Physician Finder really covered a broad gamut. One application has been in locating dermatologists and plastic surgeons for scar removal. Another has been in finding vascular surgeons and interventional radiologists for treating venous disease. Still another has been in locating global cancer treatment specialists. So the potential applications are really quite broad.
Excellent, thank you. And we have one more question here that came in. If I want to implement this Finder, how long will it take to set up? Perhaps, Chris, you could answer that for us.
Sure, and Michelle, feel free to jump in. Yeah, so thanks for that question, Kevin. So since this state-of-the-art physician finder is designed to plug directly and seamlessly into any website, Body One can really implement this for a client in as little as really on the low end as little as a week. Some other installations, we've done some where they require really detailed customization and integration into inventory or customer relationship management systems. Those can take a few months. But really the bottom line is we can move as fast as the organization, the patients, and the clinicians require.
Yeah, like Chris was saying, because it's a plug-and-play service, like all of the programming is actually on our end, so all you need to do is add basically 3 lines of code to your site, and then if you want your own customized widget for like the sidebar, that takes a little bit of extra time, and any additional changes that are outside the normal physician finder take a little extra time, but mostly the only thing that takes time setting it up is inputting all of the data.
Okay, thank you. That was our last question that came in so far. I want to remind everyone that there's a survey in the chat box. If you could please spend a few minutes to take that. There was posted again. It's very quick, and it will give us feedback on this webinar as well as offer us ideas for future webinars. And so I'm just going to turn to each of our speakers one last time to see if they have any final thoughts before we leave. And so I'll turn to John. If you can unmute yourself.
Hi, can you hear me?
Yeah.
Terrific. Yes, well, I just want to reiterate the fact that there's so many different applications for something like the Physician Finder. We would love to just even have a follow-up conversation with everyone because this technology is quite amazing in the marketplace and very leading edge. And again, if your goals are to grow your business, your practice, your office, your customer base in any way, this is a great tool to help you do that. Thanks, Kevin.
Thanks, and we'll go to Michelle. Do you have any final thoughts before we leave today?
No, I think we covered everything, but mainly just if you want any more information about this, if you would like a personalized demo, I often give people tours of the Physician Finder, and I would be happy to walk you through all of the all of the things that the physician finder can do and answer any specific questions. But otherwise, I think that's it. Thank you for coming.
Wonderful. Thanks so much, Michelle. And then finally, we'll end with Chris. Chris, do you have any final thoughts?
Yes, I just wanted to thank all the participants, and it's so exciting to see such a global audience online and to get all the really excellent questions. So we look forward to, we at Body One look forward to working with all of you.
Thank you, Chris, and thank you to Dawn and Michelle as well. You guys all put on great presentations today, and thank you for everyone who attended today. And that's about it. Have a great day.
Thank you.